Alterations in mobility, traumatic injuries. Injuries to the musculoskeletal system can potentially cause dysfunction to the muscle, injury to the blood vessels and nerves, or skeletal dysfunction. Treatment will involve immobilization of the injury until it's healed. A strain is an injury to a muscle when it's stretched or pulled beyond its capacity. There's 3 types of strains. The first degree, we have just a mild stretching, but there's no loss of function. Pain does occur with full range of motion, however. With the second degree strain, we have a partial tearing of the muscle or tendon, a limited motion, and inability to bear weight, in addition to ecchymosis. A third degree strain is a severe muscle and or tendon tearing, severe pain, and loss of function. A contusion is soft tissue injury resulting from a blow or blunt trauma. A sprain is an injury to a ligament surrounding a joint, and it involves a sudden, unusual movement or stretching, twisting, or displacing of the joint beyond its normal range of motion, causing a partial tear or a rupture of the ligament attachment. There's 3 types of sprains. We have first degree, which is stretching and pain with movement. Second degree, which is a partial tearing of the ligament and some loss of function. And third degree, which is a complete tear or rupture of the ligament and possible bone fracture or detachment. This is what we call an avulsion fracture, in addition to abnormal joint movement. The most common joints will include the wrist, elbow, knee, and ankle. Assessment findings are going to include immediate pain followed by swelling, ecchymosis, and joint instability. We diagnose these injuries through physical examination, radiology, arthrography, and arthroscopy. We're going to treat it by following the PRICE acronym: protection, rest, ice. We can also call that ibuprofen and immobilization, compression, and elevation. Once edema is unlikely, which is about 2 days, then we can also start using heat. We can use other medications and a progressive physical therapy, in addition from protecting the site from further injury until it's healed. True or false? An acronym for the appropriate management of strains, sprains, and contusions is going to be RICES. And this is true. An acronym is going to be RICES. Instead of P, they put S as stabilization, which you could still have protection as the first. That would mean erasing immobilization from your I addition. So dislocations will occur when the articular surfaces of a joint are no longer in contact, usually caused by trauma. We may see a compartment syndrome, which is a compression of structures in a confined space that leads to pain and palsy, which would be decreased sensation and movement that could become permanent without treatment. This could also lead to the Volkmann's contracture. Complications include reduced tensile strength, future instability, which will lead to future dislocations. Common sites of dislocations include a shoulder, hip, and knee, and a partial dislocation is called a subluxation. These clients often feel or hear a popping sound. They have a sudden instability, pain, altered structural shape, a lengthening or shortening of the limb, limited range of motion, swelling, and potentially paresthesias. We diagnose with x-rays, arthrography, and arthroscopy. To treat this, we're going to manipulate it and try and get the dislocated portion back in place, then apply immobilization. Surgery, however, may be required to reduce that dislocation or repair any damage from it. Nurses need to make sure pain medication is being offered. Neurovascular checks need to be done. And remember, this is going to include checking the pulses, the temperature, movement, strength, swelling, etc. Also encourage elevation, immobilization, and the application of cold packs. Tendinitis is the inflammation of a tendon due to overuse. They are usually recurrent injuries. We have the epicondylitis, which would be the tennis elbow. We may see the ganglion cysts in the wrist, and we may see carpal tunnel syndrome. These clients experience pain, inflammation, and loss of sensation. We diagnose through electromyography, x-ray studies. Carpal tunnel syndrome would have a positive Tinel sign or Phelan sign. We'll treat it with ice and heat, rest, well-planned exercise, NSAIDs and other medications, splinting, physical therapy, and potentially surgery. Nurses need to educate the client on procedures, medications, and methods to prevent further pain and injury. So true or false? Rest is an important facet of the medical treatment of tendinitis. This is true. Rotator cuff tear is a traumatic injury to the shoulder from chronic overuse of the shoulder joint. These clients have pain and limited mobility. We diagnose it through physical examination, x-rays, arthrography, or maybe MRIs. We treat it with NSAIDs, rest, immobilization, maybe some corticosteroid injections, progressive exercises and stretching, surgery, and nurses need to provide education on immobilization, pain medications, and the need for physical therapy. Ligament and meniscal injuries are from traumatic injuries resulting from a blow or a twisting motion with hyperextension of the knee. Meniscal injuries will usually occur with that twisting motion or maybe repeated squats. These clients have pain, instability of the joint, ambulatory difficulty. They may hear or feel a popping or tearing. They may have locking of the joint and clicking with ambulation if there's a meniscal injury. We treat it with NSAIDs, ice, immobilization, limited weight bearing, progressive activity, and surgery. A ruptured Achilles tendon is usually from trauma. These clients will hear a loud pop and have severe pain. They'll have an inability to plantar flex their foot. It does require surgical repair, then a cast or brace, and once healing has completed, physical therapy. Clients need to be educated on activity restrictions, ambulatory aids, and pain management. So true or false? Many clients who rupture their Achilles tendon will report hearing a loud pop at the time of injury. This is true. So fractures are a break in the continuity of a bone, and they can affect tissues or organs. These are caused from a sudden direct or indirect force, bone weakness. We need to realize older adults are going to be more prone to fractures because they have an increased bone resorption and a decreased bone formation. There are several classifications of fractures. We've already briefly talked about the avulsion fracture, where there's a pulling away of a fragment of the bone by the ligament or the tendon. A comminuted fracture is going to involve splintering of the bone. A compound fracture is where the bone will extend through the skin or mucous membranes. A compression fracture is when the bones have been compressed, such as a vertebral compression. This is usually from a fall where the client lands on their bottom. Depressed fracture, we have fragments of the bone that are driven inward. Picture a skull fracture from a blow to the head. An epiphyseal fracture would be a fracture through the symphysis. A green stick fracture, we see this most often in children. One side of the bone will be bent and one side will be broken. An impacted fracture is where bone fragments are driven into other bone fragments. An oblique fracture will occur at an angle across the bone. A pathologic fracture is a fracture in diseased bone, and no injury is necessary for this type of fracture. A simple fracture does not break the skin, whereas a spiral fracture will twist around the shaft of the bone. A transverse fracture is basically a straight line across the bone. These clients are going to have loss of function, pain, deformity, a false motion, crepitus, edema, spasm, tissue, and potentially nerve damage. We diagnose with X-ray and sometimes some type of a scan. Stages of healing. Healing will begin immediately after a bone fracture. Blood begins to seep into that area and a hematoma or blood clot will form. After about a week, osteoblasts will form as that clot begins to shrink. After about 3 weeks, a procallus will form and it helps stabilize that fracture. In about 6 to 12 weeks, we see a callus within the bone cells forming, and 3 to 4 months, the osteoblasts begin that remodeling process of the fracture site. And if that fractured bone has been accurately aligned during healing, remodeling will be complete in about 12 months. So the goal of medical management is going to be to reestablish the functional continuity of the bone. We treat it with traction, closed or open reduction, internal or external fixation, and cast application. It is all going to depend on the location of the fracture, the severity of the fracture, the client's age, and their overall physical condition. Nurses should perform their neurovascular assessments, assist with ADLs as necessary, promote mobility, prevent complications, teach cast care, a mobilization device used, and education on traction. One thing that we do need to teach our clients when they have a cast or something on an extremity is to move the portion of the body that's distal to the cast. In other words, if they have a cast on their wrist and hand, they need to know that they should be wiggling their fingers. This is going to promote circulation. Complications of fractures include shock, a fat embolism, a pulmonary embolism, compartment syndrome, delayed bone healing, which is failure of the bone to heal at the expected rate, although we do need to realize that older adults may heal at a slower rate. With delayed bone healing, sometimes we'll see non-union where the ends of the bones are not aligned, or malunion where the ends of the bones heal in a malformed position. Additional complications include infection, the avascular necrosis, where we have death of the bone from an insufficient blood supply, and those immobility complications. So a fractured femur will occur from a fall or motor vehicle accidents. These clients have severe pain, swelling, and bruising. Muscle spasms are also very common. We treat it with traction, potentially an external fixator or a spica cast. Nurses need to help prevent any immobility complications and make sure that we're cleaning pin sites. A hip fracture will usually involve a fracture of the proximal end of the femur or the femoral neck. These clients often have the fracture from a fall, a bone disorder, or some other type of trauma. And it does occur most often in adults that have been diagnosed with osteoporosis. These clients will also experience severe pain, but they'll also have shortening and external rotation of the leg, blood loss, extensive bruising, edema, and contained bleeding. In other words, the bleeding is within the hip or upper thigh area itself, and it can become quite edematous with the loss of blood. We diagnose through X-ray. These clients will require either a total hip arthroplasty or a hemoarthroplasty. Sometimes we can just go in and repair that joint. Nurses need to, once again, help prevent immobility complications, and we also need to institute positioning precautions, for example, with abductor pillows or trochanter rolls.